Hello, all. Happy June 17th. Welcome to the Common Good Podcast. It's a Thursday, which means we get to talk about issues that matter to us in this country as we call one another to live out the common good in our lives, in our relationships, in our voting, in how we handle ourselves. And really excited today to talk about the important issue of healthcare and how healthcare is related to health insurance and how health insurance is related to the entire healthcare system. Because if the one thing we all hold in common is that we need to find ways to be healthy from, the time that we come into this world till the time we leave it. That's a shared experience, and really excited today to be talking about this with someone who knows more about it than anyone I've ever spoken to. So the issues of the healthcare system and healthcare life, and I'm really excited to have Wendell Potter here. Wendell is a number of things. He's the president of the Business Leaders for Healthcare Transformation organization and the leader of the Center for Health and Democracy. But previous to that, Wendell, as he says on his own website, abandoned his role in 2008 as the vice president for corporate communications for the health insurance company Cigna. Now, back in 2008, boy, our country was dealing with healthcare at a whole other level, and there was a lot of information coming and going and ways that we were thinking about healthcare that was happening in our world, and health insurance companies had a major role in that. Well, Wendell Potter was leading Cigna's corporate communication team and serving as a chief corporate spokesperson. And since then, he has now describes himself, as he does on his own Twitter profile, as the former vice president at Cigna and whistleblower and reformed insurance propagandist. And Wendell, that is one of the great descriptions that someone could give to themselves. Wendell has written a book, Deadly Spin, an insurance company insider speaks out on how corporate PR is killing the healthcare and deceiving Americans. So, Wendell Potter, it is such an honor to have you with us today. And you're obviously someone who has strong feelings about these things, and those feelings come from what you know in your work as a public relations and spokesperson for the insurance industry. And you're equally as passionate now, trying to communicate what you know to be the truth. So, we're glad to have you with us.
Thanks so much. It's an honor, and I appreciate the chance to talk with you, Doug. Thanks for having me on.
Now, Wendell, you have chosen to be someone who's very public about the way you used to work and the things that you used to say and do. And you've written books about it. You're on MSNBC and CNN and places talking about our current situation where we find ourselves. So I want to ask you this. For a lot of people, they feel like the issue around health insurance and Medicare for all, that feels a little 2008, maybe a little 2016, maybe the primaries of 2020. It doesn't feel like we talk about it right now in our society. And, there's just this news story that came across my news feed today that said the Supreme Court has once again upheld Obamacare, big concern for people. So I know there's a lot of people who just feel like, all right, we've solved the healthcare situation. We're going to keep Obamacare in place. Good on that one. Things are as good as they're going to get. But you're spending your time in life and work trying to make sure that people don't only consider that our current healthcare system is the way that we ought to have it. How are you seeing our current situation around healthcare and health insurance in this country?
Well, I think what you said has a lot of validity. A lot of people do think that we've got that behind us, and one of the reasons is we don't necessarily have. Well, we're not in a political campaign right now. And there is no one really out front on the political stage advocating for going beyond the Affordable Care Act to get to a Medicare for all type system. I think it will return. The other factor is that a lot of people go day to day feeling pretty good, being pretty healthy. They don't really understand the limitations of their health insurance plan. They don't realize, for example, that they could be in a plan that requires them to pay more than $17,000 out of their own pockets before their coverage kicks in.
I'm in one
Uh,
of those. Yep.
yeah,
That's exactly what
and,
our plan dictates. It's
yeah,
terrible.
and what that means. So we're, in many cases, living on borrowed time.
Yeah.
And unfortunately, a lot of people find out when they get sick or injured uh, just how bad that situation is. And of course, we still have 30 million of us who don't have health insurance. I don't think, frankly, that enough Americans care about the health and well being of those folks. We tend to think of ourselves as compassionate folks, but we're very focused on our own selves. But we don't know enough even about our own health insurance coverage.
Yeah.
Uh, and we don't realize that we're gambling with our lives and our bank accounts with the current system that we have.
So you have this very provocative image on the front of your website from an article that you had, I think, in the Washington Post, and it has a Canadian flag that then is sort of being painted over with a U.S. flag. You're advocating for the United States to move to something more like the Canadian system. Uh, do you feel like the options that exist right now in other countries are sufficient to what's going on in the United States, or does the United States have to create a whole way of doing healthcare, both the delivery system, the training for that system, the reimbursement for that system, how it's paid for? Do you think the United States needs something unique to itself, or is it evident to you that no, what is existing in other countries, Canada or the UK or other parts of Europe, would work here in the US?
I'm going to steal a line from the trade association for my former industry. The trade association is called America's Health Insurance Plans. And they said during the debate on what became the Affordable Care Act that what we need is a uniquely American healthcare system.
Uh-huh.
And I agree with that. We are unique, and many of us hold firm to the notion that there is a thing called American exceptionalism. I don't think necessarily we can just import a healthcare system from another country, including Canada's, but there are things that we can learn from Canada and all the other countries as we look to really move beyond where we are. No system is perfect. I will say this, that the Canadian system is far better in terms of controlling cost and making sure everyone has access to good coverage, good care. And we have vilified that system for a long, long time. And that's why I wrote that piece for the Washington Post, because in my old job as a propagandist, I wanted you and everybody else to think that that was socialism, and that Lord knows we wouldn't want to have
Yeah.
a system like that in this country.
When you were working in PR and corporate communications, did you feel then like you were a propagandist, or did that come to you only after you saw that the things you were saying were not accurate or were not leading to the kind of outcome you wanted? Did you feel it at the time, or how does a corporate communication?
Not initially. I felt for at least the first part of my career that I was doing honorable work and wasn't really paying a lot of attention to exactly what I was doing for a living. I was making a good salary, taking care of my family. And when all that's going on, you can kind of compartmentalize some things that you do and think that you're doing the right thing, certainly doing the right thing for yourself and your family, and not be able to give a lot of thought to the well-being of others, or even what your company is doing that is not right.
Mm.
I guess I, in a sense, became more aware on my 42nd birthday, soon after I joined Cigna. This would have been in 1993. One of my new colleagues, gave me a little birthday gift. It was intended to be a gag gift. It was a framed quote by E.B. White, an author and someone who wrote a lot about how to write and write well. And the quote was, "Be obscure clearly." And we laughed and laughed about that, but that's what I did for a living. I obscured a lot of information. I would say that I didn't knowingly outright lie in the way I guess that most people would consider lying to be. But if you leave out important details, if you don't tell the full story, that's obscuring, and that's misleading. And that was a lot of what I did day in and day out. I ultimately came to have a crisis of conscience and
Mm.
realize, when I saw face to face with Americans who were victims of our current system that was largely created by health insurance companies, I had to come to grips with what I was doing for a living and the harm that I was causing as a propagandist. And I had to live with the reality that I was doing that. I was a newspaper reporter in my first career and might not have done what I ultimately did had I not been a journalist, because in that career, I always tried to be honest and straightforward, never to knowingly leave anything out, never to obscure an important fact. But I realized that's what I was actually doing and being paid well, being paid more than I was being paid as a reporter uh, in my career in the life insurance business.
When you were coming to this realization that it was dawning on you that there were important things, what was that, just an internal struggle, or were there meetings that you were in where you were having to say to the other people you worked with, I need to say this, I have to include this other information, and was that an internal organizational struggle, or was this the kind of thing that you were dealing with yourself and finally just had to step away?
It was both. I mean, there was a period of time that I thought, well, maybe I can not leave this job. Maybe there are ways that I can work within the current system to effect change,
Yeah,
or
yeah.
change the way that companies operate in the business. I quickly realized that was futile. That was not going to
Mm,
happen, because decisions were made way above my pay grade
mhm.
to pursue a certain strategy. And there was one thing in particular. There was a time that I really came to understand the futility of trying to work within the system. I was charged with the responsibility of writing what we referred to as a white paper about the problem of the uninsured. This was before the Affordable Care Act was passed, and we were getting close to having 50 million Americans without health insurance in this country. And I was writing a piece. I was told to write this, and it was clear that the intent was to try to make people think that the problem of the uninsured was no big deal,
Yeah.
that people who were uninsured were that way by choice. And to obscure, I'm going to go back to that word again, to obscure the very real reality that a lot of people, millions of people, were that way because insurance companies either would not sell them coverage because of a pre existing condition, because of their health status, or they couldn't afford to pay the premiums. And that was the main reason why we had 50 million people without insurance before
Mhm.
the Affordable Care Act was passed. And it's a big reason why, yet today, we have 30 million people who don't have health insurance. And there are many millions more who have health insurance that they frankly cannot use because insurance companies make people pay, as we said before, so much out of their own pockets, they just can't get the care that they need.
I don't want to drag you back 13 years, but 13, 14 years ago, this whole conversation was happening about, our our political system, who we're going to elect as the president, what agenda can be set around health insurance. And it felt like then that going with Barack Obama, we were going to end up with a radically different healthcare system. And to me, I have been, disappointed for 11 years about what we ended up with was a bolstered insurance system that was taken care of, was supported by more people having to buy into it, including my family. That now we're in the insurance system. I thought what we were going to get was a revolution in healthcare delivery, in the way we would experience healthcare. And what it ended up being was a change in the reimbursement system through insurance to doctors. Everything else in the system stayed the same. And now I go on to some exchange and am offered, $900 a month premiums for my wife and I with a 13 to $17,000 deductible. And I got to tell you, as somebody who I agree. I thought the Affordable Care Act was, as the current president put it to Barack Obama, whispering in his ear, a big effing deal. But frankly, it's disappointing. And it feels like that someone who advocates for people to pay attention to Democrats and consider voting for them in their life, nobody wants to say this, that you sort of feel like if you start critiquing the Affordable Care Act as not going far enough, you feel like you're siding with the insurrectionists or something, and you don't want to be in on that side. So I think there's a lot of people who feel this real frustration that there was a moment in history, and yes, something good happened. More people were brought into Medicare and Medicaid, and that seems to be where the solution was found, was a public system for them.
Mhm.
Um, did you have any hopes back then, 10 or 11 years ago, that the system of healthcare delivery would be changed, or is this always only going to be about the reimbursement system? And frankly, I think the Medicare for all, also only solves one side of the equation. It only solves the side of reimbursement and what rates and by whom does reimbursement to the privatized medical delivery system happen. And I'm somebody who wants to advocate for public healthcare delivery system, not just public reimbursement of private healthcare system. I know for a lot of people, they don't think about this. That sentence didn't make a lot of sense to them, but you start thinking about it, it becomes important. So that's a lot. Any reactions to that, or how were you thinking about it back when you came out as a whistleblower and stepped away from the insurance industry and all? Did you think there was some other change possible?
At the time, I was hopeful when I first came out as a whistleblower, and my first time out was in testimony before a Senate committee, and I testified before Congress several times after that as well. And I initially was advocating and hopeful that Congress would go much further, and that the Obama administration go much further than it did. I supported a single payer healthcare system like the Canadian system, but it became very clear that policymakers that were supportive of reform and the Obama administration itself compromised almost out of the gate. And at that time, there was very little, almost no real consideration given to far-reaching reform that we really need. So that was a great disappointment. It was a very, 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 very clear, very quickly on that the administration and members of Congress cut deals with the insurance industry, the drug industry, and others because they were so powerful and still are, and probably even more powerful than they were then. And but I had covered Congress as a newspaper reporter. I had spent a lot of time in Washington then, and later on working in the industry. So I know the ropes. I know political realities, and it was disappointing. But I came to support the Affordable Care Act as it, was finally voted on, reluctantly. But I knew that it would do some good. Might have been a step forward. So it's been a disappointment and continues to be. Congress missed a lot. A lot needs to be fixed, and we need to go much beyond the Affordable Care Act.
Do you think Medicare for all goes far enough, or is that also an incremental move? Or do you feel like, boy, if we could get Medicare for all or some version of it, does that solve the issues that you think are needing to be solved?
No, it doesn't. And in fact, we need to talk about improved Medicare and Medicare for all, for one thing. The current Medicare program has been a lifesaver for millions and millions of Americans over more than half a century now. It is a publicly financed program, privately delivered program, as you know. But it doesn't cover enough, and people have to pay too much out of their own pockets, even in the Medicare program, unless they can afford to buy a supplemental plan. It doesn't cover dental or hearing or vision care, certainly not long-term care. So there are a lot of gaps in the current Medicare program. That needs to be fixed, and we hear a lot of talk in Washington now about doing that and expanding it gradually to include more people, maybe going down to the age of 60. That's good, but you first need to fix the current program. You also need to make sure that you've got a program that controls healthcare costs and also addresses quality of care and is focused on keeping people well. We have I'm not even going to call it a healthcare system because it's not an appropriate term. We have a sickness industry in this country. We have companies making huge amounts of money selling us drugs that keep us well, but don't cure us necessarily. And we don't address what's referred to as the social determinants of health in an appropriate way. In other words, looking at other things that we need to do as a society and the government must do to address the reasons why Americans have such poor health when you compare it to other countries.
I live in Minnesota, and I know you're going to be part of a really great event next Tuesday, June 22nd, from 6:30 to 8:30 p.m., where people can ask you questions. You'll respond to people, and people can find out about that at healthcareforallminnesotans.org. In Minnesota, there's a law that you cannot have for-profit insurance companies. So all the insurance companies here are nonprofits. And that shocks a lot of people because they've been told, oh, the reason that health insurance is so broken is because it's a for-profit entity. You can follow the money and you'll find out that these for-profit agencies are just gobbling up all the money. But in the United States or in Minnesota, it has to be a nonprofit. So there's huge United Healthcare, huge nonprofit, health insurance delivery systems, and it's still all screwed up here. So it's
Yeah.
not just that. So can you help us understand, like, what is it in the insurance? Like, I do want to talk about a dreamy world where we have a different healthcare delivery system and the whole thing is put together in a different way. But until then, what is it that you know from inside of the health insurance industries that that allows it to remain so broken? If moving to nonprofit, demanding nonprofit health insurance companies isn't the solution, why is it so broken, and what can we do about it?
Yeah, and I think it's supremely ironic, by the way, that in Minnesota, non for-profit hospitals, for-profit insurance companies cannot operate. Um, but the largest insurance company, for-profit insurance company, is based there, United Healthcare, as you
United
mentioned.
Healthcare, yeah, they're based here. Anyway,
Yeah, but it's somewhat even though what you said is absolutely correct. That pertains largely to state regulated health insurance, and most people get their coverage through an employer. So United has customers in Minnesota. Cigna does. Aetna does. All the big insurance companies that sell primarily to employers. If you get your coverage through the workplace and you're in Minnesota, you could have your coverage through United Healthcare, or that could be your carrier. So, and relatively few Americans have coverage in any state on the so-called individual or small group market that is
mm.
regulated by state insurance commissioners. So that's one thing. I do
Oh, I
think
didn't know
that
that.
the reason why, two things. One of the things is that for-profit insurers kind of they call the shots in the way health insurance companies operate, even the nonprofit ones. The nonprofits have come to look and act and behave just exactly, for the most part, like for-profits. They have to because again, the rules of the road have been set by the big guys, and they can't stay in business if they don't do business in a similar way. The reason why they're still around and even getting more involved in our lives, getting bigger, is because of our broken political system.
Mm.
And that's why I wrote my most recent book is called Nation on the Take: How Big Money Corrupts Our Democracy and What We Can Do About It. And that's what I tell every audience that I can. I appreciate your question that you may support healthcare reform, you may support Medicare for all or single payer, whatever it is you support. Uh, we're just, in a sense, spinning our wheels. We've got to also support reform to our political system that reduces the ability of big corporations like United and Cigna and Aetna, where I worked, to be able to call the shots in Washington and St. Paul and everywhere else. They can and they do. They spend enormous sums of money on campaign contributions, on lobbying, and on propaganda campaigns to make us think the way they want us to think, behave, and vote the way they want us to vote. Until we do some things that reduces their power and ability to do that. And since I left Cigna, these companies have gotten even bigger and stronger and more powerful and richer than they ever were.
What is it that they want us to think? Like, why does it work for them to unleash propaganda campaigns or to push politicians? Like, from the inside, what is it that they want politicians to vote for? If we eliminated all insurance company money from the lobbying system, right? It's just a fantasy world there, that they just couldn't operate there. We treated them like a foreign government, right? You can't do it here. You can't influence. What would politicians then put into law that health insurance companies don't want put into law? Like, what is it that they're, I get it that they're doing something. They have lobbyists, they have trade organizations, they're spending money on campaigns, and then they're nudging, hinting, demanding. What are those demands that they're putting into place?
Well, they're putting demands in place because the status quo works extraordinarily well for health insurance companies. It's an extraordinarily profitable business, particularly in areas that we may not have time to talk about. But the so-called Medicare Advantage program, big
Mhm.
insurance companies are getting more and more into the Medicare program, making money hand over fist, and with a lot of policymakers, including a lot of Democrats, are just fine with that. I'm not. But uh, if they did not have as much power as they do now, if they couldn't call the shots, if there were more restrictions on lobbying and campaign contributions and other things that need to be changed, I think a lot of lawmakers would be more emboldened and would vote in a system that they know in their hearts we need, but they're held back because you
And, and
can't.
what and what would that system be? What would they would it be Medicare for all? Is that where they would go?
It's possible that they would. I consider Medicare for all as a means of getting to where we need to wind up, as a path to that, and it could be some other form. I'm not saying it's the only way to get there, but I think it is of the proposals that we've seen, one of the best, if not the best. But here's the thing: we need to have universal coverage. We need to have a system, first of all, but we need, like every other developed country in the world, to make sure that everyone who lives in this country has coverage, has access to care that they need. We need to have a system in which there is some assurance that the system is more equitable. We have an incredibly inequitable system right now. Uh, People of color are especially disadvantaged in this country. We need a system in which there is the ability to control healthcare costs. Private insurance companies cannot, nor do they really want to control healthcare costs, despite what they say. I know they don't
Huh.
really care because as prices go up, uh, if the price of drugs go up, hospital prices go up. In the current system, they can just demand more in premiums, so that gives them more money
Hmm.
and more profits. So we need to have, ultimately, our goal, in my view, is universal coverage, access to quality care, and a system that doesn't permit discrimination based on age or gender or health status. And we've got to have some means of controlling costs that we just simply don't have right now.
Can we get there without the healthcare delivery system being transformed? Like, can
No,
we get there only? Okay, say more about that.
no, you can't. And that goes hand in hand with what I was saying, what we were talking about. The current system with insurance companies largely running the show, um, they are not able to really uh, change or control the behavior or the prices on the healthcare delivery side. We have a system in which a lot of hospital systems make enormous profits, but still you have big areas of the country where there are no hospitals,
Yeah.
where there are people who are nowhere close to having the access to the care that they need. So you've got
So
to change how healthcare is delivered in this country as well.
So when some people hear this, they're like, "Well, what would that look like?" And so you give examples like, "Well, in the VA system, the veteran system,
Hmm.
those doctors work in the VA system, right? So there's not an insurance exchange there. They
Yeah.
are part of a health delivery system where the doctors and the nurses and they're all part of the VA system." And people are like, "Well, that's not a good example. The VA is a disaster." Or you say, "Well, we have county hospitals that then are funded and run by the county, and these are the places where private hospitals tell other folks to go if they're uninsured." People are like, "I've been to the Hennepin County Hospital. I don't want to go there. Those are terrible places. Like that's the least quality." So these little examples that we have of what public delivery system would look like, which I advocate for a public delivery system, uh, finding examples that people would say like, "Well, that's a good idea," are harder to find. Um, is that part of the problem that there's a public perception of public healthcare delivery systems that is inaccurate, or that those systems need to be made better before we can ever get someone to imagine that we don't just need a reimbursement system that covers all, but that people can access the healthcare at the provider side?
The answer is yes to both, and I don't mean to be coy here, but for one thing, you mentioned the word perception, and we have a perception that the VA, for example, is just a mess. It's not.
Mhm.
It's not perfect, and there were some stories of bad decisions and people not getting the care that they need in certain places. Um, but those were stories, and actions have been put in place to address those shortcomings. It does have the ability to negotiate for lower drug prices that no other part of our system does. And millions and millions of veterans have gotten good quality care through the VA system throughout history and even today. So there is a PR problem that VA has because it doesn't do a world of good. The reality, though, is more can be done to make that a better system, and certainly the whole system needs to be looked at. With hospitals broadly, you're right. We spend far too little in this country on public health and supporting our public health hospitals and institutions. They can be better. One of the parts of one of the Medicare for All bills, by the way, the one in the House, the lead sponsor of which is Pramila Jayapal of Washington State, would create global budgeting for hospital care. And what that means is, and the state of Maryland has done this, so it's not a foreign concept by any means. It is a system in which the government, whether it's a state or the federal government, determines how much a hospital should have, how much they would need to provide good care. And it has served Marylanders very well. They have almost had no rural hospital closures like in many states. In my home state of Tennessee, more than a dozen have closed in
Yeah.
recent years. And the hospitals offer good quality care. Some of the best hospitals in the world are in Maryland. So you need a system in which hospital administrators have the assurance that they're going to have enough money to do what they need to do to meet the healthcare
Mm.
needs of people in their communities. In the current system, that doesn't happen with insurance companies negotiating individually with each hospital. Often there are hospitals that have size and clout that they can get a better deal than a smaller hospital somewhere out in the far reaches of the state. So a system like what Maryland has put in place is something I think that the rest of the country needs to look at, and that would be created under legislation that's already before Congress.
I know that there's a real connection between the pharmaceutical industry and local doctors. That's been now well regulated. I know people who work in the medical services economy and pharmaceutical economy, and it's very managed about how they can talk to a doctor. Uh, does that same thing exist between insurance peoples and doctors? Is there a world that exists where doctors are being courted, talked to by the insurance industry? And is that a problem if there is?
Oh, it's absolutely a problem. One of my jobs, my responsibilities in my old job was at times to recruit doctors to be allies, to carry our water for us, if you will. Um, I can remember one campaign years ago in which we were trying to bolster the reputation of managed care. And we recruited doctors to be our spokespeople because we knew that
Mhm.
doctors, and they still do, are held in pretty high regard. Not as much as they once were, but certainly much higher regard than insurance company bureaucrats. So they're courted, and a lot of them are ideologically um, disposed to defend the current system because many of them are doing just fine with the current system. Many of them are not. Primary care doctors are not paid well enough. And the other thing is that insurance companies have gotten more and more between us and our doctors, and more and more doctors
Mm-hmm.
are
Mm-hmm.
receiving that. We have something called prior authorization, which means that doctors often have to ask permission before they can treat a patient or even prescribe a medication for their patient. And so I think increasingly you're seeing that providers are less willing, largely, to be shills for the health insurance business.
Is that something that an average person can know about or can engage with? So if they go to see their doctor and their doctor says, "Hey, here's this procedure, medication that I want you to engage in," and they hear, "Well, talk to David out front. He's our insurance liaison. He will try to get the pre-authorization to go through."
Yeah.
And then you end up going out there and you sit and you wait to find out about it. And it's this whole kabuki theater, that sort of goes on about how that happens. Is there anything we as individuals who are consumers of healthcare can do about that? Or is this one of those things where you say, look, this is just how the system goes, and we have to change the system before any of you are going to have a different experience? Do we have any leverage or power, short of saying, I don't know, I'm going to pick a different doctor, that we can do in those moments that the insurance company knows that individuals have as their power and they're trying to keep you from knowing about as one of the positions of power that you have?
Yes, absolutely. We have more power as individuals, but it's also important to understand that if we can come together with others in groups and organizations,
Hmm.
uh, then your voice has more impact. So there are things you can do as individuals to reach out to your member of Congress, or your state legislator, your governor, your insurance commissioner, to squawk about things that don't seem right. One thing that is holding us back is that we grew up with this system, and we've been told that we have the best system in the world. We put up with this kabuki theater because we think it's normal, and that nobody else in the world could do things better than we. We have this American exceptionalism, as I noted
Hmm.
earlier,
Hmm.
and uh, that's a real thing and a real barrier, and something that holds us back from the reforms that we need. So we need to come to terms with that. We also need to know that majority of us are just too busy. We don't pay enough attention.
Totally.
We don't get involved, and just let things happen to us. So it requires a few people to be noisy, to be active. And unfortunately, as you noted earlier, I'm going to be speaking on a in a video thing pretty soon, next week, uh, and we'll be talking to folks who I know are already motivated, and hopefully many others will tune in and be persuaded to get active. It doesn't take a huge army of folks. It takes a few folks to get things going and to affect change.
And that event, by the way, you can get to if you go to the website hca-mn.org. So healthcare for all Minnesota.org, hca-mn.org. Uh, Wendell, there are a lot of, like you said, we're all busy and people are trying to figure it out. And honestly, just navigating the simple sign up for your health insurance, know which doctor you can go to, open a letter that says this is not a bill, and then you're not sure why they sent it to you, and then pretty soon you get a bill and you're like, how in the world could that have cost that much? uh, People get exhausted with this, and no one likes to feel dumb. It's one of the operating principles of the world, I think. So when people get into this world, they feel like they don't know what's going on. It feels disempowering. They don't know the language. I know people who care so much about healthcare and they don't even know what single payer system means. And they sometimes would confuse universal healthcare with Medicare for all, with single payer system, with community based doctoring and hospitals. Like all of this just, it's almost seems like it's designed to obscure, like you said, right? And it's full of acronyms, and
Mhm.
it's full of people feeling like, I don't even know what I'm talking about. How could I ever be involved in this? That feels like one of the major issues that we're all facing, and then just feeling defeated because, boy, there was big fights about this for the last decade, and it's all the same. It just sits here in the status quo. Can you give us a little good hope that if you don't know and you don't understand and you don't know how this is going to go, that it's still worth the effort, it's still worth the time? Is there a cheat sheet somewhere that somebody can figure out how to get briefed up quickly on these issues if they care about it and they want to go a step further than what they heard Bernie Sanders or Elizabeth Warren say at on a political stage for the 2 minutes that they had to talk about this issue?
All you said is very, very true. We do kind of throw up our hands because it is such a complex system. We have a Rube Goldberg kind of contraption that we call our healthcare system. It's enormously complex, and people are baffled by it, and that plays right into the hands of the insurance companies because the more confused we are and hesitant to speak out, to even call when we think that we've been overcharged or a claim has not been paid that should be paid. We're intimidated by the system, often don't even know how to begin, just think it's going to be futile. That is something I've always encouraged people to be a squeaky wheel if they're not being treated right in one way or another. It's intimidating, but you've got to do it. You got to be your own advocate in many cases, or get someone to advocate for you. I think I am absolutely hopeful. If I weren't, I wouldn't be doing what I'm doing.
Okay.
I'm approaching my 70th birthday, and I could be playing golf or hanging out at the beach with my grandkids. But this is important, and I wouldn't be doing this if I didn't think that we could absolutely get to a system that we need to have. It's going to take people like those who are behind Healthcare for All Minnesota, for example, or Physicians for a National Health health program like there in Minnesota. They've been around for a while and they're leading the charge. I hope people will check out those organizations and figure out how they can be supportive and join the effort. Give whatever you can give, whether it's money or time, or just educate yourself. Those organizations have a lot of information. Check out the organizations that I lead. One of them is Business Leaders for Healthcare Transformation. The current system doesn't work for our employers. That's why I lead this organization. We've got more than 3,000 business members across the country, every state, including there in Minnesota, employers. And that is one reason why I have hope, is that employers are getting sick and tired of being taken advantage of by insurance companies. They know they've been sold a bill of goods. So they're beginning to step up and be a part of this conversation and this effort to change things.
I think if a lot of people knew that a lot of physicians are behind these efforts, they want to see it different. If they knew that businesses, and I think more businesses should be advocating for some version of a single payer system, so it gets it off of their books and on to someplace else, right? Where your employment relationship doesn't all of a sudden have you having to have someone who's navigating with an insurance company. Like, why in the world businesses tolerate this is really shocking to me. Yeah. And that a lot of doctors are having to run their own small businesses.
Yes.
For a lot of people, they don't know that the risk that a doctor takes, I'm not just talking about repaying their overpriced, medical school loans, but the day-to-day operations for a doctor to have to run their own business or practice is so onerous for them and you might think, like, my doctor spent 9 minutes with me, maybe, during that visit, right? And then I get this bill for X amount of dollars. But all the people that it takes to operate that system, much of which is navigate all those people in the office around there that are having to navigate insurance claims and taking your insurance card over and making another photocopy of it and making you fill out that ridiculous little form, like just all of that goes on, that we all were told was going to be solved by having this electronic health care thing. Remember when that was a deal? And I still am handed a piece of paper on a clipboard with an email spot that's not long enough to write an entire email address. Like it feels like none of that has changed, and so much pressure is put on the doctors to have to run a business in an environment that's not conducive, that they sell their practices into big conglomerates and kind of get out of the personal doctoring business and don't want to be primary care physicians. Will we see a movement among doctors and businesses? I know you're leading an organization that way. I know Healthcare for All Minnesotans, Healthcare for All Minnesota is with physicians. Is that really what it's going to take? That it's not going to be just individual insurance purchasers and healthcare purchasers? Is it going to take a big lobbying effort from businesses and from doctors to make it clear that this is crushing them as much as it is everyone else?
I think so, and I think you're seeing more and more evidence that doctors are beginning to say this doesn't work for them. Uh, there's one big propaganda outfit that's based in D.C. that is called the Partnership for America's Healthcare Future. If you see anything from that outfit, or there may be soon something called Minnesota Healthcare for Minnesota's Future, something like that. Know that that's a propaganda outfit funded largely by insurance companies. Uh, I mention that because the American Medical Association, for a little bit of time, was a part of that, and then they dropped out.
Huh.
And I think that organization and doctors are realizing that to affiliate and carry the water of the insurance industry, they do that at their own peril. Because I can assure you, insurance companies care nothing about doctors and their well-being and how they care for their patients. So doctors are waking up to that. I think your ultimate point is correct. It's going to take them. It's going to take employers and us as individuals to rise up more than we have, to get more involved. And I'll go back to what I said before. It's not just involved in pressing for healthcare reform. We also have to address the corruptness of our political system that enables the system to be perpetuated, that enables companies like the ones that I work for to keep making as much money as they do to reward their shareholders while the rest of us are not getting the care that we need.
So that group that you mentioned, and now I don't remember the name of it. Would you say the lobby or the propagandist group?
Yeah, the Partnership for America's Healthcare Future. It's
I
run
see
out of
TV. I see
yeah.
TV commercials from those people, right? So yeah, oh yeah, I've seen them, and I always wonder when I see those kinds of things, and I raise that to say, like, no, I see their messaging because they believe that messaging is going to have an effect. So
Yeah.
some people who think, well, what good is it going to do to even say this stuff? No one's listening. That's not what they think. They're spending millions of dollars on TV ads and postcards that are being sent and social media messages. They believe it's going to work.
Yeah.
Coca-Cola believes that putting a Coke ad up is going to remind you to buy Coca. Like, messaging works. It really does have an impact, and it's
Yeah.
not always about only how much money was spent on the campaign. So people that feel like, well, small efforts aren't going to work. These folks wouldn't have offices in DC. They wouldn't have trade organizations, which, just so people know, that's also what are often referred to as lobbying groups. Now, there's a lot of groups that lobby. Moms Demand Action, anti-gun violence movement, lobbies. That's what so lobbying is what you do. Lobbying is when you get a group of people together and you go and say to your legislator, here's what we want. The question is not, are we going to have people lobbying, standing in the lobby and waiting to meet the congressperson when they come out, right? And influencing them. The question is there only going to be those groups that are lobbying? Like, are politicians only going to hear from these folks? And Wendell, I don't know what your experience has been, but I have the privilege of being around a lot of Congress people and candidates. We do training for candidates on how to message to voters that we think matter. These are not people that often know a lot about healthcare, right? Like you become a member of Congress for a whole lot of reasons, and on your portfolio are very important issues. The details of healthcare, that's something you don't know. So this is going to be true of every senator and of every representative. They have to depend on their staff to learn and know what they know. They can't know everything. Their staff are often young people who are also learning the ropes. So they turn to trusted voices. They turn to trade groups to help them understand the issues, from soybeans to, toilet flow valves to light bulbs to healthcare. That's the role these trade groups play, is they pass the information on in briefs and packets
Mhm.
and data and all this. They're pushing information. So
Yeah.
sometimes, and I'm not trying to give a break to the broken political system, but the way we think it works isn't someone slipping somebody a bag full of, $100 bills and saying, you're going to vote our way, right here, Congressman. It's much more integrated in, do you need to know how to think about this? Let us do a briefing with your staff. Let us give you a white paper. Let us deliver to you some talking point and all of this work. Is that what you were doing as well? And can you say a bit about how that influence actually works? First of all, so people aren't convinced that it's some clandestine, sneaky business, and that they know that their own voicing and their own messaging and groups like the ones that you're helping to lead and the ones that they see they're trying to advocate for this actually do have a pathway to being effective.
Yeah, I can absolutely speak to that because, yes, I was a part of that. I helped craft talking points for our lobbyists to give to lawmakers and their staff. If you go to Capitol Hill in Washington or St. Paul, you'll find that if you pay attention, that it's just the halls are just swarming with lobbyists for big industries. They're ever present and they develop relationships with lawmakers and staff. That's how it's done. You're exactly right. But I can tell you that you can push back and defeat that, even though your budget is much smaller. And I'm going to uh, uh, brag about the work that the Center for Health and Democracy, my organization, does and has done in two states just early this year, in Nevada and Colorado. Both states were looking to try to establish a state-based public option. And that doesn't go nearly as far enough as a lot of Medicare for All advocates support, but it represents meaningful reform. And the advocates in those states ask my group to join them in trying to push back against the industry's propaganda. And we made a big difference. The insurance industry in Colorado spent more lobbying against the legislation there than any industry has ever spent in Colorado history. But this week, the governor signed into law a bill that was worth signing. It moves the ball forward. And my group and I personally sent letters to every lawmaker in Colorado. I wrote op-eds that appeared in Colorado newspapers. I called Colorado legislators personally from time to time. We put together a folder showing just how the industry and that partnership really works, and it helped make a difference. We did
Yeah.
similar things in Nevada. I testified twice virtually before at Nevada legislative hearings. So we had a teeny tiny fraction of the budget that the insurance industry
Right.
had, but we made a difference. So know that this is a David versus Goliath fight, and always will be. But David can win.
Yeah, that's a great way to say it. So the biggest, health issue that the nation has faced has been the COVID-19 pandemic. How has that changed the circumstance around all of these issues? Are we in a different place now in June of 2021 than we would have been in January of 2020? Is there something that has changed the environment? Has it gotten better, worse, same, shifted, the river moved? Where do we find ourselves in light of the pandemic?
I think clearly we're in a different place, and we'll never go back necessarily fully to where we were. For one thing, Americans are more used to, and so are healthcare providers, more used to telehealth. It has a real role to play, and it can make people, it can help people uh, be able to keep a doctor's appointment that they otherwise might, for example.
Hmm.
Um, there are some things that I think have developed that's useful. The problem is that we have short memories, and the pandemic will at some point be in our rearview mirror, and we will allow things to just kind of return to the way things were,
Yeah.
or maybe get even worse. Uh, I think that many people have become aware of the problem of people even fearing how much they're going to have to pay out of their own pockets, even to get a test for COVID-19 or to be treated
Yeah.
by it. So there is some, I think, greater awareness of just how much we are likely to have to pay even with insurance. So I'm hopeful that Americans have learned a lesson about just how our system failed us. We've had
Yeah.
more than 600,000 people who have died, which is just unbelievable and unconscionable. Uh, but uh, even with that, a lot of folks don't think that it was the crisis that it really was.
Yeah, I'm with you on that. If you had said to someone in January of 2020, in the next 18 months, 600,000 people are going to die with or of the same condition, and ultimately, and it's going to put the healthcare system into such crisis that we will shut down the economy so people don't overwhelm the healthcare system, because our healthcare system is so fragile and unscalable and doesn't work for a major pandemic crisis. If you'd said that to somebody in 2020 and said, and then by September of 2021, people are going to say, we don't need any changes to our healthcare system. Everything is fine. That would have seemed just impossible, right? We would have said, no, no, no. This was a September 11th moment. This was the kind of thing that's going to change the trajectory. Boy, it doesn't feel like it's happening. I mean, we're all glad the pandemic is over for those who are vaccinated, at least in the way that it was, and feeling like there's been some success. But this autopsy on why we had to shut down our economy because our hospitals were going to be overwhelmed and they didn't have the capacity to treat one another, and you know th- that just seems to be that no one is using that shared reality to shine a light on the fact that this healthcare system that we have, even when it works really, really well, is very fragile and doesn't have the capacity and had to be bailed out by public dollars. Like, why don't we just go all the way to that and make it more robust? Do you hear any conversations in the world that you're in that people are going to take seriously the vulnerabilities that exist in our healthcare system, or are we just going to make sure that we have enough masks hidden away in Texas somewhere so next time this happens, we can distribute masks to people effectively?
I don't hear enough conversation, but I do know, and I know some of the people who were certainly advising the Biden administration about how to deal with this pandemic in ways that we hadn't before. I have confidence in them, and I think that they helped the administration steer the ship in a better way. I I do think that uh, we may have some benefit from the pandemic in that people are more aware of the absurdity of having coverage through their workplace.
Yeah.
Millions of people lost not only their jobs but their health insurance
Health
along with it
insurance.
because it was tied to where they worked. That's ridiculous, and it's one of the things that we've got to address. And as I said earlier, people are more aware than I think they were of how much
Yeah.
we have to pay out of our own pockets, even with insurance. So I think there's some awareness. Organizations need to do more, and that's why again I'm sticking with this. And the organizations that I lead are really trying to be as vocal and active as we possibly can everywhere in the country. More need to do that, and there are organizations that are doing it. Um, Often they get very little visibility. We've got
Yeah.
to figure out ways for them to get more traction, to figure out messaging better. What you said earlier is absolutely correct. The other side knows all about messaging. They also, if you look closely, you'll see that most of their messaging is fear mongering. That's what I used to do. You want to make people fear change, and we've got to figure out ways, we as advocates, to overcome that and message succinctly. And know people have short attention spans. They're not going to sit around for a long-winded explanation about how you think the system should be changed. You've got to spend some resources. But again, I'll reiterate: you don't have to have as much money as the other side to make a big difference.
Yeah, it is still. I don't think Medicare for all solves all the problems, but it sure is better than not having it. And what is confusing to me is people, when they get to place of Medicare, they'll have to figure out some supplemental insurance. A lot of people, or some prescription supplement. But man, people are thrilled. You rarely meet someone who says, I do not support Medicare for all, that when they reach the age where they can be on Medicare are like, and that's why I'm not going on Medicare. They
Oh, you're
don't say
absolutely.
that. So
They do not.
why this idea that it's 65 or 67 or move it to 60 or wherever we end up with the number, why that would be something you'd be opposed to until the moment you can get on it and then you hop on it. It is
Yeah,
just the strangest thing that this continues to wheel
yeah,
about. Like if we were going
yeah.
to fix the system, it'd be better to fix it when everybody is in a Medicare for all system. Then we fix it from there rather than this convoluted, broken up system that we currently have.
Yeah, it's because we're all gullible. We don't really we're not quite as smart as we all think we are as Americans, and being as gullible and malleable as we are certainly is a big problem. Holds us back, but it's a reality. It's a thing.
Yeah, and look, I mean, for all the for all the libertarian types out there that want to say like, I refuse to pay $800 a month in taxes for healthcare. That would be insane. Why would you ask me to do that? But I gladly pay $800 to to my health insurance provider for healthcare a month. Somehow that seems like it's a better deal, right? Like I'm willing
I
to pay
know.
them. I just don't want to pay the government. And I know it's rooted in anti-government narrative and anti-government theory here, which is ultimately what we have to get after. And that's part of the milieu of all of this is you realize we're not talking about healthcare. We're not talking about insurance. We're talking about the role of the federal or state government as opposed to the role of a nonprofit or private industry. And that's the conversation that we're having. And that's really where people are fighting. They're not fighting only because they want to make sure that, you keep your health insurance in place. They're fighting because they want to make sure you don't become one more step integrated with the government.
It's
And
true.
do you all have to do any of that work, or do you keep that to the side, that sort of root cause of why people who would be opposed to Medicare at age 59 and then all for it at age 69?
Oh no, it is part of the work that we do. You've got to work across so many different fronts to educate people in certain ways. You're right. People are ideologically uh, influenced to think the government can't do things right. And I was a part of that effort. I was part of the effort to get people to distrust their government. It's more subtle than most people think, but we have opinions about our government and its ability to do things right and run programs correctly. To your other point, though, I never once encountered anyone who was not happy with their Medicare program compared to a private insurance company. I can't tell you how many people who were counting the days until they turned 65 to be Medicare eligible. Um, but there is this paradox that continues about people who say, on the one hand, that the government can't do anything right, but can't wait till they are able to enroll in a publicly funded healthcare program like Medicare.
Right. And they'll rage, keep your socialist hands off of my Medicare, that kind
Right.
of thing. I'm not just trying to make fun of people who don't know. I'm not trying to take advantage of them for not knowing, but it's that contradiction that we know exists. My wife and I pay more money in our health insurance premiums than we pay in taxes. Like it's crazy.
Yeah.
And we don't even use it. Like we're not even like we're zero prescription people. We keep all of it because one car accident or one diagnosis, we don't want to bankrupt us. So somehow we've been convinced that we're funding, we're just paying $800, $900 a month for something we don't even access and use. I know that's not true for some people. For some, it's a great, it's a reasonable deal. But there's a whole lot of people out here who are just funding a system, and talk about not knowing what you're getting for it. It's just bananas, and that's through the exchange as a part of the Affordable Care Act. So
Yeah.
I don't know what part of affordable I'm missing, but it's really on the edge. And we had a brief period of time right after the launch of the Affordable Care Act where, because we had kids, we qualified for the Minnesota Care. That was the greatest insurance experience we had ever had. I mean, we just piled it all in. We did it all. It was great. So we had a little taste of maybe what things could be like, and maybe we'll time into by getting into Medicare at some point. if we live that long, and what it could be like for others. So I don't know. It's this is such mind bending conflict we find ourselves in. But Wendell, really glad for you and for the good work that you're doing. And again, if people want to connect with you next week on Tuesday, you're going to be in a live forum that people can watch from anywhere. You're going to be in conversation with Healthcare for All Minnesotans, and they can find out the information at hca-mn.org. And if they want a little more Wendell Porter in their life, they can get it next Tuesday from 6:30 to 8:30.
I hope people will tune in. Please
Well,
join us.
really, yeah. Thank you for being a part of our Common Good podcast today. We really do appreciate you.
Thanks so much, Doug. You take care.
All right, Al, thanks for being with us today. And we'll be back with you, a little conversation about economics tomorrow with Fadl, our economist, and we're going to be talking about cryptocurrency. I can't wait. All right, so we'll see you tomorrow at 10 a.m.